I am Dr. Mohammad Abu Bakr, Professor of Medicine, Consultant Physician, TX Hospital, Kachiguda. I am having past 25 years of internal medicine experience, and I am also having 25 years of treating diabetic patients. Patients from the age of 6 months to 100 years also I have managed diabetes. So I would like to tell you what is diabetes. People think that diabetes, once you get it, is not curable. It is not reversible, but diabetes can be cured completely with latest medication. Diabetes remission is also possible. Remission means you can avoid the medication for 1 to 5 years once you get correct guidance from the doctor. So let us know what is diabetes. Whenever your blood sugar goes, fasting blood sugar goes more than 110, it is known as impaired fasting glucose. These are the persons who are likely to get diabetes in future. When your fasting blood sugar is anything above 126, it is confirmed diabetes. Overnight fasting is very important. Suppose if you have taken dinner at 8 o'clock in the evening and morning you check fasting blood glucose at 8 o'clock, 8 am. So it should not be more than 126. If it is coming in between 110 to 126, it is impaired fasting glucose. Below 100, non-diabetic range. And post-lunch blood sugar should not cross more than 180. Post-lunch means 90 minutes after breakfast. Okay, that it should not cross more than 180. And if it crosses more than 180 and 200, the lifestyle modification immediately should be started. If it is going more than 200, treatment initiation should be done under the guidance of a qualified doctor. What are the risk factors? Risk factors, family history is very important. If both the parents are suffering from diabetes, 50% of the children are likely to develop diabetes at any age. Suppose if the father gets the diabetes at the age of 60 years, the son is likely to get the same diabetes at the age of 30 years old. So risk factors is more than 45 years of age, and if the brother or sister is also suffering from diabetes, that is also a risk factor. And wherever the patient is taking some medication, like medication for heart diseases, medication for hypertension, medication for thyroid, that is also a risk factor for diabetes. Whenever there was a diabetes during pregnancy, that is known as gestational diabetes, so such candidates likely to develop diabetes after the age of 35 years. A woman with polycystic ovarian disease, in the future she can develop. Any overweight patient can develop diabetes. Whoever is not physically active can develop diabetes. Whoever is having very high blood pressure can develop diabetes. Whoever is having abnormal bad cholesterol levels, that is triglyceride levels and LDL levels are above the normal range. What are the symptoms? Coming to the symptoms of diabetes, so most of the patients, 50%, more than 50% of the patients are asymptomatic or silent. They don't complain of anything. They acclimatize to themselves. If they are passing excess urine in the night or in the daytime also, they think that it is due to their excess water drinking or due to their lifestyle or something. They don't notice it. If they are losing some weight also, they don't notice it. If they are hungry also, they don't notice it. So the symptoms are, patient always feels thirsty, hungry all the time, patient wants to eat something. There may be a sudden weight loss and patient feels very tired, sleepy or not in a good mood. Vision changes can occur. There may be some wound which is not healing. There may be a numbness in the body, there may be a sweating, excessive sweating may be there. How do you monitor your blood sugar levels? Nowadays, with the help of blood glucometer, you can manage your sugar levels nicely at home. That is known as self-monitoring of blood glucose. SMBG, self-monitoring of blood glucose. So in that, if you develop diabetes and if you start monitoring, if you don't take medication, and if you adjust your lifestyle, if you try to reduce your carbohydrate intake for 3 to 6 months, if you continuously monitor the blood sugar levels, then I think remission is possible in that case, because by monitoring, if your fasting blood glucose is somewhere around 160, you will go back to the dinner and what I have eaten, what went wrong, and you can reduce the carbohydrate intake in the dinner, and you can do an early dinner, and your fasting blood glucose may be below 120. So if you go on number of times, if you go on checking, ideally you have to check 5 times daily: before breakfast, after breakfast, before lunch, then after lunch, even at dinner or after dinner. minimum 5 to 6 times if you check. Then if you are monitoring regularly, if you are counting your carbohydrates, then you need not worry about starting the treatment. Okay, thank you.